We can sit down. No, I'm not. Hi, Luda. I'm Danielle. I'm a nursing student. My privacy. Can I see your wristband? What's your name?
Luda Treta.
And date of birth?
February 21st, 1976.
Okay, I'm going to be giving you a health assessment from your head to your heart today. I read your health history, so I'm going to go ahead and start with your vitals. Can I see your wrist again? I'm going to check your pulse. Pulse would be between 60 and 100, and her breath would be between 12 and 20 per minute. Then I check the temperature. This under your tongue. It's going to be 93. Now I'm going to check her blood pressure. Her blood pressure is about 102/82, so that's good. That's in range. I would also have an O2 or a pulse ox, which would go over her finger and it would read the oxygen in her blood. And you would want it to be above 95. Okay, can I ask you to put your shoes on really quickly and we'll come to the scale. Turn around. I would document all of this as I was going. Now, I noticed as she was walking, her gait is normal, so her motor skills are working. You can go ahead and sit down. Okay, so what is your name?
Luda Treta.
And do you know what day it is?
Yes.
What day is it?
February 14. Oh, October 14.
It's February
2016.
Okay. And do you know where you are?
Yes, we are at Jimana Community College.
Okay. So she's oriented, so she does not need a mini mental, and she obviously doesn't need a Glasgow coma. Her motor skills are working. She's happy. She's cooperative. Can you please push my hands? Okay, now pull. Now can you squeeze my fingers? Okay. You push my hands down, pull them up. I'm going to wash my hands after that. I'm going to be checking her cranial nerves now. Olfactory is for smell. Optic is eye movement. Oculomotor is eye movement. Trochlear is eye movement. Trigeminal is facial expression. Abducens is lateral eye movement. Facial is smiling and frowning. Acoustic is hearing. Glossopharyngeal is swallowing. Vagus is gag reflex. Accessory is shrugging her shoulders. And hypoglossal will be like sticking out her tongue. I'm going to test her smell first. Can you tell me what this smell is while closing your eyes?
Lemon.
Okay, so number 1 is good. I get my ophthalmoscope. Her ocular appendix is good. Okay, so can you follow my pen with your eyes? So her cranial nerves 3, 4, and 6 are intact. Now can you close your eyes and can you tell me where the cotton ball touches your face?
Left cheek, right cheek, nose.
Perfect. And so, and then 5 is good. Can you smile for me? Now frown. And now poof your cheeks out. Okay. So 7 is intact. Now I'm gonna have you cover one ear, and I want you to repeat what I'm saying.
A, B, C.
Okay. Cover your other ear.
1, 2, 3.
Great. So your nerve 8 is intact. Now I'm going to check for her cranial nerve 9. So that's her gag reflex. Can you open your mouth for me and say ah? I don't want to actually. I'm sorry. So that one. And that was vagus, so that's good. Okay, now I want you to try to push my hand with your head. Okay? And now your shoulders, try to push your. Great. Okay, so her accessory cranial nerve is intact. Okay, now can you stick your tongue out? Perfect. Now I'm going to start inspecting her. We'll start with her head. Looking for other hair, looking the way her hair is placed. I'm looking for any bumps, bruises, abrasions, any irregularities. I'm looking for symmetry, any infestations. Do you wear glasses or contacts?
No.
No. And when was the last time that you had an eye exam?
Last month.
Okay, so I don't have to do an eye sound chart. Okay, I'm gonna just pull your eyelids down a little bit. I'm looking at the sclera, making sure it's clear. I'm looking for no conjunctiva. I'm looking for no lid lag, no nystagmus. And then I'm also looking at the positioning of her eyes, making sure they're symmetrical, and there's no drainage. And I'm going to check her pupils. I'm going to look at the size. They are about a 2 or a 3. I'm going to make sure that they're both round and that they're reactive to light and that they are accommodating. And they are. Okay. Now I'm going to look at her ears. I'm going to notice that they're symmetrical. They're about at her eye level. I'm going to look into them. I'm going to look. Make sure that they're relaxed. That the tympanic membrane is pearly gray, and I can see the cone of light. Now I'm looking at her nose. I'm looking to make sure it's symmetrical, that it's not sticking out one way or the other. Can you cover one nostril and breathe in for me? Okay, that nostril's clear. Now the next one. Okay, that one's clear. You're gonna look. You're going to visualize her septum, make sure it's intact and it's straight, and there's no obstructions. Excuse me. All right, now I'm gonna check her sinuses, her frontal. Make sure they're not poking out, they're not stuffed. Her ethmoid, maxillary, all feels good. Now I'm gonna look at her mouth. Her lips are pink. There's no cracks. They're nice and moist. I'm gonna ask her to open her mouth.
Yes.
Go ahead and open your mouth, and I'm gonna look in. I'm gonna make sure that her membranes are moist. Everything's pink. There's no obstructions. There's no drainage. There's no lesions in her mouth. Okay. Now I'm going to look. I'm gonna walk around. I'm gonna feel her thyroid. I'm gonna go ahead and take one of these. Can you swallow for me? And now I'm going to palpate her lymph nodes. Making sure none of them are swollen. Looking at her skin as a whole, there's no lesions. Her color is good. There's no excessive moisture. It's not dry. I'm going to check her turgor in your hand, and it bounces right back. I'm going to check her cap refill, capillary refill. And they refill in less than 3 seconds. And I'm looking at her hair distribution on her body because missing hair can be indicative of a problem. There's no edema. There's no clubbing in her fingernails. I'm going to look at her axilla. Make sure there's nothing swollen in there. And I know this patient very well, so I trust her armpits. Do you smoke? Do you use any kind of tobacco?
No.
Okay, that's good. Now can I just watch you breathe? Okay, I'm gonna walk around to the back of her to test to make sure her breathing is equal. Okay, breathe in real deep for me. Okay, and it's symmetrical on each side. Sorry. Do you have any shortness of breath or coughing issues right now?
No.
Okay, I'm gonna have you go ahead and lay down. You can sit back for me. I'm gonna listen to you breathe. Bronchial vesicular. Vesicular. Oh, I'm sorry. Is it cold? Okay, and I was listening for wheezes, rhonchi, or crackles, and there was no adventitious lung sounds. Now I'm going to talk about her heart. So have you had any chest pain recently? Any difficulty breathing? All right, I'm going to listen to your heart now. Listening. There's no murmurs in S3 or S4. Now I'm going to listen to her carotid artery for the sound of bruit. There's no bruit. Now I'm going to check all of her pulses to make sure that they're equal on each side and they're all strong. So temporal. I already tested her apical when I was listening to her heart. So now I'm going to do carotid one at a time. Okay, now I'm going to do brachial. Can you see her arm? Radial. Ulnar. Okay, can you lay down for me? I'm going to check femoral. Popliteal. 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 Posterior tibialis. Thank you. And dorsalis pedis. Okay. Once again, I'm just going to look her over for any edema, any discoloration, anything abnormal. And then I would ask her if there's anything else that's bothering her, if there's anything I can do for her. I would wash my hands and I would document. The end.